All right, well, welcome. Today we have the pleasure of having Dr. Nicole Saphier. She's a radiologist, director of breast imaging at Memorial Sloan Kettering, Monmouth. She's one of the more famous guests we've had on. She spends a fair amount of time giving her opinions from a medical health policy standpoint on Fox News and a variety of different shows there. Has a huge following. She's super vocal about her opinions on healthcare and medicine, which make her an incredibly interesting follow on social media as well. So she has a very active Twitter account with lots and lots of fans. So Nicole, thanks so much for coming on the show.
Hey, thanks for having me. Excited to be here. And yes, I am quite opinionated.
Which we like. So the reason we have Dr. Saphier here is Dr. Saphier wrote a book, and which is coming out soon, correct? In the next week or so is the official launch?
That's right. And it's available for pre-sale even before then.
Oh, wonderful. And so she's on to talk about the book. The name of the book is Make America Healthy Again. So tell me why did you want to write this book?
Well, I think I've kind of alluded to before why I wrote this book. And to be honest, it was kind of a pet project. I have 3 sons and also work full time. And when my oldest son was going off to college, I needed to funnel some of that emotion into something. And instead of taking up knitting, I decided to write a book. And, I was thinking of, what is it, to write a book, you have to really feel passionate about something, unless you're just a natural writer, which I am not by any stretch of the imagination. And the one thing that I am getting increasingly frustrated with is listening to people on the left and on the right, politics, talk about healthcare. And everybody seems to have an opinion on it. Everyone seems to think that they know what's best or what's right. And, the truth is no one actually knows what's right. But the bigger truth, and the one that I'm more interested in, it doesn't matter what health policy you want to put forward, whether it's some sort of socialized medicine in terms of Medicare for all, or even expanded Affordable Care Act, or if you wanted a completely privatized system, nothing is going to work while we're still bankrupting our entire nation due to preventable chronic illness. And to me, that is the biggest issue, is how much of this is illness, cardiovascular disease, cancer, mental health illnesses, a product of our own doing. And if that is the case, then why aren't we doing anything about that per se, instead of just figuring out who's going to pay for what?
Yeah, and that's the theme that runs through your book, is this idea that is the idea of the individual's responsibilities, and would that be a fair kind of theme to say that it's somewhat playing off of what John F. Kennedy said, don't ask what can you do for your country?
Yes, exactly. So I'm a big believer in individual behavior can have a massive effect on society. And I think I'm not going to ever be able to convince everybody in the world to do a certain thing. But if some people just did a little bit more, it would be quite impactful. And the big thing for me is I don't think we live in a society full of bad guys. I think a lot of it has to do with a lack of education. Many people don't actually know what they're doing, maybe causing problems. Some people know what they're doing. But I would say the majority of people don't actually know that certain behaviors are bad, and is actually really contributing to this overall deficit that we're dealing with. And so my goal, just like why I went into radiology, breast radiology specifically, is to educate. I want to educate on early detection of cancer when it's most treatable. I want to educate on preventable illness. So how can we get past that? And how can we not only make a single person healthier, but make an entire nation healthier, and therefore overall reducing the cost of healthcare?
So how possible, how plausible is it? Because part of the issue that you lay out is that we're living longer and longer, right? Life expectancy, over the last century has gone from, somewhere in the 40s to, up in the high 70s. And just with that comes a lot of chronic illnesses, wouldn't you say? So just age by itself brings you a lot of chronic illnesses. So,
well, absolutely.
How do we, yeah.
You mentioned, you're right, because I mentioned that in my book and I talk about that. But one of the biggest thing is age. However, we look at the blue zones, which I talk about also. And the blue zones are these areas across the globe where you have a lot of people living to over 100 years of age. And they're doing just fine. They're doing a lot better than a lot of Americans are doing right now while they're suffering from COVID-19 because of our chronic illness problem here. So I wanted to look at why are they doing okay and we're not.
And people will counter and say that, it's kind of, it's a little bit of a selection bias, because obviously we see all the time that, oh, exercise is great. And, the 75-year-old who, looks like they're 40 and has not on any medications that I see. And I ask him well, how did you do this? He's like, oh, it's because I've been having turmeric with my coffee for the last X number of years. Right. So, and it's a small joke, but, they are much fitter, so, but how do you know that they're just not genetically, blessed? And, the reason they're exercising at 75 and still running a 10K is because, that's just, they were handed a genetic jackpot that allowed them to get there. And that the reason you're not seeing all the other folks is that, they unfortunately had problems and were kind of given a different lot, when they started out.
Sure. Well, selection bias and observational bias always impede on a lot of our studying, but you have to look at the United States. The United States itself is a very diverse nation. So we can't just say Americans fit into one selection and now we're just comparing them to a blue zone, because the truth is these blue zones are all throughout the world. You have them in Italy and Greece, and then one actually happens to be in Loma Linda, California. And these people in Loma Linda, California, they're not all of the same genetic lineage. And it is because of a lifestyle that is they're healthier. And they're not fitness models. They're not out at the gym every day. They're not necessarily on a pure vegan diet. It is an overall healthier lifestyle. And looking at the United States, you can break this down, not just, East Coast, West Coast, and everything in between, or even by states, but even certain cities or counties within states have higher obesity, per capita than other places. And so it's really these traits, the actual characteristics of the people and their behaviors that are predisposing them to this illness. And yes, although genetics and familial upbringing have a lot to do with it, a lot of it too can be behaviors, because we say, certain diseases run in families and they may have a genetic component, or it may just be clustered in that family group because of a clustered lifestyle.
Yeah, so it gets hard. So the other counter is beyond genetics, because not everyone can be you and your husband make a very very good looking. We should mention Dr. Saphier. I'm sorry, I don't know his first name. What is his first name?
Paul Saphier.
Paul Saphier. Yeah, so he's a hotshot neurosurgeon, and you guys make a very good looking couple. So not everyone wins this Saphier genetic jackpot. So that's one issue, of course, is that some people may not have the same things, but you point out very well that of course there's a lot of Americans that don't necessarily live a very healthy life, right? And we talk about you talk about obesity, and COVID, of course, other than being male, I think being obese is the other biggest one of the biggest points in terms of what causes you to do badly if you do get COVID. But what about the idea that structurally America is set up so that the folks that are obese are in a lower socioeconomic status, that live in poor areas, that have access to Twinkies but don't have access to the whole foods and avocado toast or whatever.
Sure, absolutely. I actually think you've touched on, I think I mentioned avocado toast.
Yeah.
And the disparities in why people eat certain things in the book.
I do my homework.
You sure do. I guess you did read it. So, you're absolutely right. And the big food industry has made our chronic overweight problem such an issue. It's not only is it less expensive, but come on, let's be honest, it actually tastes pretty good. I will tell you, occasionally when I have a really bad day, getting a quarter pounder at McDonald's is like my version of what some people may do with an illegal substance, because it just makes you feel good. And I'm sure it is the sodium content, it's the fat content, it's releasing all these different chemicals inside of me that's making me feel good. But the truth is, it does feel good and it's easy. And for someone like myself and the majority of America, when you are working and you're raising children and you're constantly in a rush for the next thing, they make it so easy. I don't even need utensils. I can just push it in my mouth. And so it's easy and it's affordable. And so when you have people on low income salaries, if they even are working at all, this is what is available to them. And this is why it is crucial that our wellness programs get to the lower socioeconomics. It can't, come on, let's be honest. Bill Gates doesn't need any more wellness, anything. We cannot be focusing on them. What we have to do, if we, our Medicaid and our Medicaid program costs so much money to the states, costs so much money to the country. And the thing is, we're just saying we're going to restrict it. We're going to ration the care. We're going to do, even though I think block grants are a good idea, but we're essentially limiting the amount of funds there. But we're not actually doing anything to decrease their cost. And that's the problem.
So how do we, so how do you go about doing that? How do you change behavior?
Well, I mean, that is life's greatest mystery, right? So the thing that I looked at while writing the book was you have more cigarette smoking with people on Medicaid than any other of the population. And why is that? And I don't have an answer for that, except for it doesn't seem they have the same education about the effects of smoking as maybe other people do. They don't get the same public service announcements per se, or that, I don't know. And I feel I am a big supporter of personal responsibility. And I feel that we absolutely need a government funded health insurance for the people who cannot afford it. I support that. I support the Medicaid program. I don't like the way it's rolled out, because when you remove cost sharing, then people don't actually understand potentially what the cost of their care is. And there's no incentive for them to lower their cost of care, because they just have this little plastic card and they can go to the doctor anytime they want. It doesn't matter what medications they need, because it doesn't cost them anything. What are they being incentivized at all to decrease their cost of care? They're not. The people who are the people who are actually paying for their private insurance, because they have copays, they have deductibles, and they're actually paying the premiums. So they want to keep the cost of care down. But guess what ruined that? The Affordable Care Act, because all of a sudden they said, with the most popular provision being pre-existing conditions, saying it doesn't matter how many pre-existing conditions you have, or it doesn't matter how expensive you are to insure, everyone's going to be treated the same. That immediately stripped away any sort of personal responsibility in the healthcare scheme. And in my opinion, that's the worst thing that could have happened.
Yeah, no, it is such a tough issue. You're raising the issue of moral hazard, this lack of incentive to guard against risk when you're protected from the consequences. And so it's so tough though, because obviously our children are raised in such a different environment than zip codes where there's such a massive amount of disease, right? So it's almost like it's almost like you're running a race with dumbbells, you're swimming with kind of dumbbells attached to you, because how do you go about doing it? There's a lot of the family units are very different from the family units that I've hopefully set up, that you've set up. So so the education that's coming from parents, from your community, is so different. It becomes very hard when you have folks that are living kind of almost a subsistence existence. It seems like a really hard thing to do, because it's one thing for adults, for us to kind of say, all right, you're 22, the decisions that you're going to make now are decisions that you're going to have to pay for. So but it starts so long before you're in your 20s, right? It starts when you're a 5 or 6 year old, and the only thing that your mom has time to give you, because she's working some crazy shift job, or maybe you don't even have a mom, maybe you have a grandma or something, and you're one of 6 kids. Those bad habits get inculcated so early in a way that isn't true for our kids. So that's the tough thing, Nicole, in terms of trying to figure out how to do it in a way that's fair.
But that's why we need ample resources to be able to provide for public education and put it into the schools, so our children are getting that educated. But we are strapped so thin that we don't have those resources. We're seeing school funding taken away all the time because we can't afford it. So if we actually lower the cost of care, not lower the accessibility of care, but lower the cost of care, then you're going to have more resources.
Yeah, no, absolutely. That I just, I know the Philadelphia School District, for instance, which is a pretty tough school district with, pretty high rates of non-graduation, et cetera. their annual budget is something like $3 billion a year. It works out to some 20 plus thousand per kid per year. So there's a lot of money that does get a portion. It's kind of like Medicaid, right? Medicaid, at the end of the day, the amount that's paid to doctors is so little that a lot of doctors won't take it. But yet we're giving this massive sum of money and apportioning it to the Medicaid managed programs. And, the money somehow disappears in a variety of different places. And then ultimately there's not a lot left for the important type of care, primary care, for instance, that'll prevent it. And it's the same thing happens in the education system. This is what I run up against all the time. I mean, I'm kind of a reformed liberal. It's that we want to do these things like what you're talking about in terms of let's educate, let's start public education from very early so people understand good habits, bad habits. But the issue is that it seems like the only thing that we can do as the government, whether it be state or federal or local, is give a bunch of money to a bunch of bureaucracy, and you tell the bureaucracy to do X, Y, and Z, but at the end of the day, the bureaucracy is not able to kind of affect it. So I don't know.
No, we're not all Oprah. We can't just give away schools and give away homes and cars, and there's just not, it's not a bottomless pit of funds, and we want to be able to fund these programs, but our healthcare system has bankrupted us at this point. And so the only way we want to continue to provide this supply without having to ration our care, the only way to do it is to decrease the demand. And the way that I see that forward is by decreasing preventable chronic illness. And maybe it's not going to be in the low income right now because we need to shift resources for them. But I tell you, I look around me all the time, and there are people who have enough funds and who have enough wherewithal where they can be making better choices.
Right. And so is there a way, so you're an unabashed conservative, correct? I wouldn't be.
Fiscally conservative.
Fiscally conservative, sorry.
Yes, okay. I am.
So are you then a fan of what folks like Michael Bloomberg have done in terms of trying to adjust individual behaviors in terms of soda taxes, or, you're on the warpath against McDonald's.
It's so tough. And I'm not against McDonald's. I mention it in my book. I actually support McDonald's. I don't think that they need to provide a healthier menu. You know why? Because we live in a beautiful free country with a bunch of economic freedoms, and it is our personal choice to go to McDonald's or not. Thankfully, I limit myself from going there to only a couple times a year. I think other people can decrease that as well. In terms of like the Bloomberg tax on like the big gulp sodas, you know what? Look, let's see what's going on in New York City right now. They are bankrupt because they expanded Medicaid. They had to close down hospitals. They needed to get funding from somewhere. And they realized a long time ago that it was their unhealthy lifestyle behaviors that was actually causing them to bankrupt themselves, aside from the fact that they just love to spend money on government services there. I think it's a way forward to tax people, but I don't really like that. I don't like the idea of taxing people on that at all. I don't think it should come in terms of a tax. I think you need to look at the back end. Say, okay, if you're providing health services, then you say to them, you have to maintain a certain way if you want your health insurance to cost X amount of dollars. That is what was taken away in the Affordable Care Act. So if you're on Medicaid, you need to be educated on the importance of maintaining a healthy weight. And maybe you say certain metrics. You're not saying to an obese person, you need to be normal weight within a year. I mean, that's preposterous. But you need to make sure they're on a path to the right direction. You give them educational materials, and then you give them a plan, this hopefully through a primary care doctor, on how they can get there. And even if they lost 2 pounds, reward them with a lower premium, reward them with their Medicaid, because any step in the right direction is much better than where we are. So I don't really like it in terms of taxes. I do like it in terms of ramifications and financial penalties when it comes to health insurance, because in my opinion, health insurance is, we've changed what the definition of insurance is. It is supposed to be in case you need it, not just a ticket for your health care.
Yeah, in case, so it would be, paying, so you would be okay based on a certain profile in terms of your weight, whether you smoke, you have to pay a little bit more to buy health insurance so that somebody has it. So of course, what's going to happen is that is that that's going to, of course, disproportionately impact a lower socioeconomic group that does smoke more, that does drink more, that is much more overweight.
So
So then it
maybe everyone
becomes
starts it starts the Affordable Care Act. Maybe everyone starts where they say where everyone is treated the same. And then there's a 3-month follow-up. You can make changes in 3 months. I'm not saying that you can completely stop smoking, because I'll be honest, I've never even tried a cigarette, but I do know how hard it is for some people to quit.
Right.
But there are metrics that can be measured. And if you give positive versus negative incentives, that will promulgate better behavior. And I just believe in that.
Yeah, and your thoughts are to do it via the insurance thing, not necessarily to, not necessarily. I mean, you do pay more. You do, of course, to buy a pack of cigarettes. I mean, I think how much are taxes relative to what the actual cigarette costs?
Never bought a pack, don't know, but I hear it's expensive.
Yeah, it's super expensive, and it's interesting because it's almost like society looks the other way on it. I mean, there's a lot of stuff I feel like that's like outlawed that you can't do, but hey, you can smoke, even though we all know, my God, what a massive cost that is, right, to society on one end. But it's interesting to me that everyone kind of partly looks the other way, because it's kind of like the state is the mafia that kind of gets a cut of it, and because they're getting a cut of every cigarette, so it's almost like, well, cocaine would be okay too, as long as you give 50% of every cocaine sale.
Yeah, but I don't want to have to pay for the people's ruptured brain aneurysms.
Yeah. So one way would be to, I don't understand why, and I believe Seema Verma did this when she was in Indiana, is that to direct some of these sin taxes, direct those to paying for health insurance. So it's almost like, so every that additional amount that you're paying with your cigarette tax, well, that's the money, in an aggregate pool together, that's going to ultimately pay for, your surgery for lung cancer or breast cancer or whatever, other, COPD, that type of thing.
Yeah, but instead, it's not going to. It'll never get there.
I know, but it's terrible. That's all politics, right? Because the state is so addicted to those funds, and that they will never ever say, okay, these are the funds that we're only going to give to. We're going to apportion this only for medical care, which is, I think, really unfortunate, because that seems like, seems something that should be relatively easy. So the other thing, you talked briefly about the free market. How do you think the free market kind of plays a role in healthcare? Some people say, of course, the free market has no role in healthcare.
Well, I think that the free market is essential in healthcare. If we look at what we're dealing with COVID-19, our private sector is the reason that we're actually getting PPE and testing to our healthcare workers. So I think it is vital that we have a large private sector. I mean, that's why we lead the world in research and development and technology. For some reason, we don't produce it here because it's cheaper everywhere else. However, I mean, it is our think tanks here that get it. And, I think that you really sacrifice quality when you turn everything public. I mean, I can tell you some of the greatest physicians I have ever met are not at the big institutions like where I'm at, but are in the private sector, because they don't want to have to see a ton of patients. They just want to still have a good lifestyle. And they're so good at what they do that they don't have to. They don't have to run it like, patients in every 15 minutes. And I think that you really increase your quality by having a private system. Unfortunately, again, in the era of EMR and online reviews, it really is taking away from that. A lot of the out-of-network legislations are really just putting shackles on the private healthcare sector, and you're seeing all these massive consolidations, all of which I think are just overall bad for our long-term stability.
So when you're talking free market, you're talking specifically in this case about physician self-employment, right? As opposed to hospital employment and the autonomy that kind of gets stripped away from you and whatnot. But in terms of, you talk about how the free market introduces certain redundancies. Do you think, the free market, I'll be more specific. The idea that the free market induces a profit motive, and that profit motive then is bad for patients, and that profit motive, certainly, I know you write a couple times on the profit motive in the pharmaceutical industry, and that may not work well. Are those do those things run counter?
Well, it's a double-edged sword in the sense that, the profit aspect is why we have so much, um, you know, venture capitalism in that sector, because of the potential of such great profit. That is why you have so much funding and support there, and why medications are able to even be made. We're able to fund these large research trials, and a lot of medications fail, so they have to make up for those losses.
Yeah.
And so because of this funding is why we're able to have these. However, of course, we have seen some really bad actors that have jacked up prices and really give the pharmaceutical industry an overall bad rap. So, I start going against, all right, well, I don't think that, Bernie Sanders said that certain pharmaceutical industries should only make X amount of profit. And it was such a low number that it was just, I mean, no one's going to produce any medications if that's the only profit that they're going to get. And so I don't necessarily want to do that, but I do wonder, like, is there a limit that up to the profit that should be made off of medications that are treating illnesses? And the truth is, I don't necessarily have an answer to that, but I do think it's a great question for discussion. And I do think that, we need to work together so that people can make sure that they get the medication, because I don't like the concept that only the people that can afford a medication should be able to have that medication. But I also want to maintain the profitability of these pharmaceutical companies, because I believe that what they're doing is truly wonderful. And I believe that they do deserve a big profit, because that's the industry they went in. I wasn't smart enough to go into that. I became a doctor. And even though I like what I do, if I could have been someone who sold off a company a million years ago and I'm flying private right now, great for me, but that wasn't me. But so I actually am okay with people making money, because I support that. And what they did is groundbreaking. I just wonder, do these CEOs, do these hospital administrators really need such large bonuses when you have so many people suffering? I don't know. It doesn't sit well.
Yeah, it certainly doesn't. The optics of it don't look good. But it becomes hard, because then if you how do you draw the line? Because then if you depending on where you draw the line, it's like, well, why is Dr. Coca make what he makes? I mean, he could you can live on a lot less. So it becomes very hard in terms of drawing the line and stuff. It is, the thing that doesn't get mentioned. Well, sorry, it does get mentioned, but it's papered over in much of the narrative that we see, certainly in mainstream media. It is the idea that regardless of where a pharmaceutical company is located, whether it's located in Switzerland or in China or in India or whatever, they are making whatever it is they're making with their eye towards this massive prize that is the American market. So, and the pharmaceutical industry has given us some type of, you talk about HIV turning into a disease that you can live with, right? Which who would have imagined that in the late 80s when it first kind of came out. And so it's hard you want to be really, really careful about touching the pharmaceutical industry in the way that some of the central planners like Bernie Sanders talk about, because my goodness, if we just what happens if we really destroy or put a wrench in kind of the innovation center for the world? That's going to be a major issue. Again, with COVID-19, the companies, all the companies that are kind of gearing up to kind of get this going, are many of them are with the massive expertise and technical know-how that exists in the U.S. So
in addition to increased hand hygiene that I think is going to come out of the COVID-19 crisis, I think that the American people are finally seeing our dependence on foreign drug making and manufacturing. And you already see bipartisan legislation being put through right now about bringing this back to the United States. And I think that might be a potential good thing that comes from all this, that we're going to start having a lot more manufacturing in the United States.
Yeah, no, and I mean, we're certainly. It seems that we're certainly going to be a lot less interconnected and a lot less dependent, and hopefully, maybe that'll be a good thing. Though that may mean that what we have to pay for things goes up. We may not be able to get that 80-inch TV for $400 because that's sourced next door.
Definitely a possibility.
But do you what do you think about what I did see a lot about is what do you think about what it costs to maintain hospitals?
Well, and I didn't talk on that too much. I touched on, the administrative waste, as you
Right.
know, that's a big issue for me. And the truth is, because I don't know, and I don't want to be a hypocrite as someone who does work in one of the largest cancer centers in the globe, and
Right.
now saying hospital systems are bad, because I am a part of it. And so, it's difficult, but when I listen to, Bernie Sanders and everyone else talk about the waste in administration, let me tell you, I agree with him. I mean, there's not many things I can say I agree with Bernie Sanders on, but that is absolutely it. But the thing that a lot of people don't realize is a hospital isn't just doctor seeing patient. I mean, it is a massive organization that you have the legal side, the marketing side, the research side, the public funding side. I mean, there's so many, is it cogs in a wheel? I don't know. I always mess up
Yeah.
sayings, but there's so many cogs in the wheel to make a hospital go around that, you can absolutely trim the fat, and it's not as easy as just going to a single payer health system, because that's a terrible idea. But there are ways to trim the fat. And I think that, unfortunately, that isn't looked at enough. People are just wanting easier solutions, and they like to point to health policy to make that happen, as opposed to actually looking at individual departments and at individual measures that can be taken.
What's the issue with single payer? Because if the issue is that want to reduce administrative costs, Medicare is a very low administrative cost. Why not have a bunch of doctors that simply get paid from a single payer?
Well, Medicare is not an easy administrative cost. Let's hold on a second. First of all, the Medicare billing process is painful. There are so many denials. There are so many hoops you have to go through, and then the reimbursements are lower. And then, I mean, what time? How late are we doing this? I mean, the problem with the Medicare system is you have these patients who are plugged in with the regular system. And the reason that it works is because we have the private healthcare, the private sector there. If we were just to go to a single payer system, sure. But then we're saying our doctors, you are beholden to whatever the government wants to pay you. And immediately, obviously, we know the reimbursements will be cut, but that's not even the issue. The issue is now you have turned your physicians into just employers of the state. Because yes, you can have certain systems like in Canada where you don't necessarily have to be a government employee.
Right.
But the truth is, if you only have a single payer system and you actually get rid of private healthcare, like Bernie Sanders said, even though he's no longer the running for possible nominee, but they want to get rid of the private system in general. And by doing that, then you're making your doctors, your nurses, everyone automatically becomes an employee of the state, and you are going to see we're already in the midst of a physician crisis. We have fewer people applying to medical school. We have doctors killing themselves more than veterans are killing themselves. I mean, why would you think that this is going to get better? Just because the billing side of it got better? Absolutely not. We're going to say we're just going to continue to pay them less, put more shackles on them as to what they can and cannot do.
Yeah, the hard part is that they start out, and this is what they did in Canada with their Medicare for All program, right? They started out with just this. It's like, oh my goodness, because the private insurers, of course, deny all the time, correct? And we have these battles of prior auth. And certainly traditional Medicare, right, is probably the easiest one to bill, because you bill them, and you can, I know that the feds would be knocking on my door if I did this, but I mean, technically speaking, that you order a stress test every week on a patient, and you'll get paid the week after that. So they do have this kind of rapid turnaround time. But that's always the sweet, the honey that kind of brings you in early on. And I'm sure that we've had Adam Gaffney on, who's a intensivist, who's a head of physicians for a national insurance program, whatever, or a national health insurance plan. And he says that, look, Medicare, the initial Medicare rates, we're not going to set Medicare rates at what they are now. We'll set it somewhere between what the private insurers pay right now.
But then what's going to happen?
Right, exactly right, exactly right.
Yeah.
So the key is that years down the line, once once this kind of, like every government program kind of grows out of control, like Medicare has, I mean, it's not it's not a hypothetical. That's what's happened with Medicare, and that's why you have Medicare Advantage, and that's why you have ACOs. It suddenly becomes some type of managed care that restricts the amount of rations, basically the amount of care that you can get. And so, the poor guy, and you spoke to Sean Watley from Canada, who's a very another very opinionated guy who writes a lot. And he said, he gets paid, they get paid something like $17 or $27 for like a follow-up visit. And, in order to make this work, because it is single payer, they're not employed by the state, they run their own little clinic.
Yep.
But, he sees like 40 people a day. The care is not great. If you want to get, a hip replacement or something like that done, if you're just a regular person, you have to wait an interminable amount of time. I think, and if you know somebody and they can pull some strings, then you get in faster. So it's always the elites that went out. This idea that socialism will be somehow, or kind of single payer will somehow be
and
much more equitable is kind of silly. And you bring that
but
up
at least right now you can have a large swath of people who have employer health insurance, and so you have less of the discrepancy between income there. But if you do go to a socialized state where you do allow private people who can either pay cash through concierge medicine or private healthcare, you have now really separated those classes significantly further than you have right now. And so when people are saying right now that this is unfair and only the elites get the good care, they will be a wake-up call when they actually see what would happen.
Yeah, no, I'm totally with you. I firmly believe that upper crust will do better, and it'll be the connected upper crust. And who's connected? It's the folks who have a lot of money and who have influence, and they will actually do. The disparities in care will be even more in, I think, a different type of system. You certainly bring that out. So you also talk about what it's like to be a doctor in this current system. And you have a very poignant story that you tell of a very good friend of yours that tried to hurt herself. Is this something, Nicole, that you feel like has changed over the course of your time, the 5 years that you've been in practice since you got out of medical school?
It has been longer than 5 years. Hold on a second. No. Hold on a second. Hold on, I've been at Sloan Kettering 4 years alone. Yeah, I've been out longer than that. Whether it's just more, I don't know if it is increasing. I mean, the data tells us we are seeing more physician overdoses, more physician suicides now than before. But I just wonder if I'm more aware, because all of a sudden I have a bunch of attending level friends. And I saw some of it happening while I was in medical school. I heard about a few things while I was in residency, but now that I have attending level colleagues, it is substantial. And yes, we all talk about being stressed out in medical school and residency and, the hours are long and blah, 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 trying to get a family going. But wait until you get that responsibility of actually being a doctor. You finally get there, you have this momentous experience, and you realize you're still working as many hours. And maybe your paycheck's bigger, but you have 6-figure debt. And left and right, you have administrators and legislators trying to decrease how much you get paid. And you are supposed to be this altruistic persona that you can never do wrong. And if you do, you're going to be sued for it. And most places, they won't put a limit on how much you can get sued for. It is a horrible feeling that you are expected to be this level of perfection, and there's no protection for you as an individual or you as a human. And I don't know, it's been really difficult to see some of my friends struggle. I mean, I would be remiss if I didn't say that there were times where I myself felt burnt out or felt undervalued.
Is it the, and you think is it the system? Is it the administrators? Is it the fact that physicians aren't owners of they don't own their own practices?
I think anybody can be burnt out, whether you're an employee or you are the employer. I think for me personally, I see the administrators and the constant strive for more profit, to me, is a burnout. And the the profit over patient care has just become glaringly obvious to me throughout my training and even as an attending, I just see it. And I understand that bills have to be paid and there's a bread and butter to running a hospital system and paying salaries and taking care for patients. But I also think that there is a tone, unfortunately, that although we exude that we want to always put the patient first and provide patient care, I do think that unfortunately you have to make money to do that. And so for me, I try and look at, okay, the answer is not to fire a CEO. The answer is not to necessarily get rid of so many nurse administrators or whomever. But again, because I don't want to affect the supply side. If a hospital system has great results and it is running smoothly, I don't want to change that. So what can I do on the demand side? Because it's all about a balance, supply and demand. And for some reason, all we do is focus on the supply. We will give everyone a new healthcare card. We will say you don't have to pay more for your insurance. We will continue building. We will provide everything. All the while, the demand side is also continuing to go up. And the scale, I mean, it's quite imbalanced. And if we really decrease the demand side, then all of a sudden that supply side is running much more smoothly and you don't have to worry about it as much. But I think physicians are being pulled in every direction. They're pulled from patients, pulled from these administrators. And the only person, obviously the patient will get hurt if the healthcare is bad, but the physician is the one liable for what seems to be everything. And there is very limited protection for that physician. If the physician is suffering themselves from any sort of mental illness, although everyone touts these resources for them, but the truth is you have to hide yourself because your licensing application, everything asks you about it. There's always a level of discrimination. And because we live in such a litigious society, people will use it against you. And that is why I think physicians keep things inside. And that is why I think physicians are killing themselves at a rampant rate.
So how do we go about climbing out of this hole?
Well, I mean, I started with writing a book. So for me, I realized I want to be able to talk to more people. So it started out by going to medical school. I can see so many patients a day. Then I got involved in the legislative aspect of things and I realized, wow, I can actually pass the law and I can reach a lot more people than just how many patients I can see a day. And then I went on TV. I'm like, wow, I could reach even more people and so forth. And so for me, it's all about education. I have the ears of, local policymakers and federal policymakers, and I try and give my best to educate them on matters that I see as important. And I try and do patient education programs, and I will just continue to do my small portion in educating people and really hope that individuals will start taking accountability for their health, but also help direct policymakers to come up with robust policies that will help those in need as well.
What do you see as, if you could, physicians are divided a fair amount, right? And the divide is unfortunately very much along political lines. So it kind of makes us, not very unified in terms of a voice that will both be a voice to push for things that are good for patients and for physicians. Any thoughts and ideas on how to not make things as polarized and that kind of get physicians together?
Well, it's really easy to sound like the bad guy. And so if you say anything other than you want to take care of every patient free of charge, you sound like the bad guy. And I get that. To get physicians to come together, we're terrible at it. We are terrible at coming together because think about it this way. If you say you're not going to do something, there's always someone who's going to do it for less money than you, which is why there's this constant struggle of accepting these lower rates, because the truth is someone else will do it. But bottom line, physicians need to unionize the way that nurses did. Nurses have created such a robust union. They work together, they get the pay increases together, they get their work hours. And unfortunately, I'm not sure how we can get that to that level with the physicians, because think of the AMA. They started that way. They started as a group to represent physicians, and it fell apart. And I think we need an equivalent of an AMA, but that stays less on partisan lines and that really just refocuses to the patient, to the physician, And I don't know who's going to put that together, because it's certainly not going to be me.
So how is it? You've been now at Fox for a few years. Is that right? A couple of years?
So I have been an official contributor with Fox for about 3 years, and I was going on TV a little bit before then.
Nice, great. And you feel like has that really been helpful in terms of the impact you've been making?
I would absolutely say that being on TV has given me a broader audience. People immediately, although I am fiscally conservative, you do get labeled being with certain networks, I would say, but it doesn't really matter because I speak on things that I have opinions on. And, but I have been very grateful that I have had this platform to reach even more people, because that is my overreaching goal, is that I want to educate as many people as I possibly can.
Wonderful. Well, Dr. Saphier, you've been very kind with your time. Thanks so much. You have a lot of fans, including the president, who specifically called you out the other day for what a great job you were doing. So thanks so much for writing the book. It's really great. Make America Healthy Again. Dr. Saphier, thanks for coming on.
Thanks for taking the time to read it and having me on. Bye.
Take care.